And I thank you both for that input. And I look forward, Amber, to a little further in the discussion where you can talk a little bit more specifically about what happens at the clubhouse and how crises are averted there. We talked a little bit about, at the beginning of the discussion, Dr. Souter talked a little bit about the number of calls he received last evening alone, which is mind-boggling. Elena, I'm wondering if you could address specifics about Park City, Summit County, and talk a little bit about, both Amber and Todd talked a little bit about criminalization and how there is sometimes other issues going on during a mental health crisis call that kind of makes the numbers a little bit askew because it is dealt with in a different way than a mental health crisis, which is completely understandable because officers certainly need to be concerned about their safety as well. So can you talk a little bit about that, Elena?
Absolutely. And so when a call comes in through dispatch, it's typically kind of the primary issue is typically described, whether that's an assault or a disorderly conduct with someone that's acting, you know, somewhat erratically, whether because of substances or just trauma or sometimes mental health crisis. There can be all sorts of different potential crimes that can be associated or completed as part of a mental health crisis, depending on the situation. And so with that, officers will go in and take care of the kind of primary issue, again, safety and welfare of all parties involved, and surrounding is always the primary concern for law enforcement. In some cases that may overshadow the mental health crisis if there is extreme violence, if their de-escalation is not able to kind of bring that down. That may then be classified within the system as an assault or another incident versus a mental health crisis. And so that's something, as we've gone through, there's likely more mental health issues and crises that are involved in some of these cases than are identified, simply because law enforcement are still humans and they're still trying to figure all of that out. They can't necessarily read minds, and why, again, information is power. If it's someone that they've dealt with on multiple occasions and have some history and background, they're able to respond to that a little bit differently than potentially someone that they've never interacted with that is also, you know, potentially acting violent or threatening or something like that. And so as we go through, we classify that as best we can and try to capture that. But I think it's recognized fairly broadly that there's likely more cases than we can necessarily account for that are attributed to some sort of mental health issue.
I'm going to go out on a limb here and say that perhaps media, social media, broad stream media has done a little bit of disservice to those struggling with mental illness by portraying them in a light that isn't very flattering. I also want to go out on a limb and say that law enforcement is probably also portrayed poorly. This, my experience with law enforcement on our call was so positive, and the de-escalation happened to the degree where the situation became so calm. I was afraid we weren't going to get the intervention we needed because the situation ended up with a conversation. And, you know, I was in a panic because I knew I made the call as a parent who knew their loved one needed help. And I was afraid that we weren't going to get it because it was so de-escalated. But luckily they knew enough to say, you know, there's a little bit that's outside of norm here. We get this. And so how can having the different experiences, those with mental health issues, those who have perception that law enforcement is not going to intervene properly, how can we encourage people to reach out?
I think with with law enforcement, and I appreciate kind of the insights that have been spoken by Dr. Souter and by Amber and you, Natalie, as far as law enforcement experience and interaction. You know, our law enforcement, they go through a lot of training. I would echo that they do very much care about the people within this community and want to serve them in the best ways possible. Again, they are humans that are infallible, or that are fallible, excuse me, not infallible. And they will make mistakes at times. And I think as a system, also, you know, that we're constantly looking at how we can improve, just like other aspects of our life and systems and cultures. I mean, it's something that's constantly being evaluated. How can we better serve our community? And that often looks like CIT training and bringing that in a more concerted way. It looks like taking comments and feedback from the community and having conversations. And with those conversations, I will say from those that I've had the opportunity to interact with, and from the responses with some law enforcement, that there can be some mixed experiences. However, I'll say even in those mixed experiences, that can be very impactful for law enforcement and looking at how we're approaching situations and how we can improve. And speaking for, you know, both Park City and for Summit County, that there is a desire to be improving and serving our communities, especially when it comes to more of this kind of community-oriented policing, community outreach, proactive versus reactive kind of approach.
Can I talk a little bit about kind of that proactive approach? Because as I was thinking about this question, in my experience, people are more willing to reach out if they have someone that they trust who can be an advocate for them. And Natalie, you kind of experienced that. Like, you were there advocating for your son. He was in a really rough spot. I have a Clubhouse member, and he doesn't have any friends or family in the community. Well, he has friends, his Clubhouse, but family in the community. And he says to me, he says, Amber, you know me at Baseline, right? And I'm like, yeah, I know you at Baseline. When I'm not at Baseline, you need to help me get help. And so it's this kind of this relationship of having someone that you trust be an advocate, so that I then could call the police, or if he's in a crisis, and say, you know, I'm a colleague, I'm a friend, I'm worried about this person, and there's a advocacy going on there. So I think that's really important. If you know a friend, if you have a neighbor, a family member, a coworker who you know has some mental health struggles, you know, be that advocate for them so that they feel more comfortable reaching out, and we get away from the scariness of the reaching out, I guess, is the best way.
I like, I was just going to say, I like the comment in the chat that this is a common experience for everyone. There's a song that I like by Matt Carney, and there's a line in there that says, we're all just one phone call from our knees. And I truly believe that. And Todd, I'd love to hear your thought.
Oh, I just wanted to add also, just referring back to CIT. CIT is a partnership, again, between advocacy, mental health, and law enforcement. Those three entities work together to try to improve systems. And I would say that, at least representing mental health, we make lots of mistakes. And when we make mistakes, we want to learn and hear about those so we can learn how to do better. The mistakes generally, in my opinion, are not intentional, but yet still happen because, as Milena mentioned, we're all human. So I welcome any feedback. And one of the things that we're able to do with CIT Utah, with our organization, we have relationships set up throughout the state. And I would invite anyone, if they have a negative encounter or a negative interaction, you can feel free to contact us and let us know who the officer was, which department, and we can work with our regional coordinators in that community. So the phone number, if anyone's interested, for CIT Utah, the phone number is 801-535-4653. 801-535-4653. If you have a positive one, we'd love to hear the positive ones. But if you have a negative encounter with law enforcement, share that with us. And again, with great relationship with Park City PD, I can call Zach up and say, hey, Zach, do you know Officer so-and-so? Here's the situation. And we always know there's two sides. There's two sides to every circumstance and situation. So the effort is not to blame people or to find fault, but the effort is, hey, there's a situation, didn't go the way we wanted it to go. How can we improve? How can we get better? And advocacy is such an important part of that piece, because those are often the folks who are on the front lines having the encounters. And so if we can learn from that perspective, we can try to improve and move things forward with that feedback and with that knowledge. Again, not to fault people or to find things bad, but like Natalie mentioned at the start of this conversation, let's try to keep it positive. Let's try to grow and move forward and continue to improve and do better, which is what we're all about. We want to, again, provide the best responses we can to our community. So please feel free to call that CIT Utah number. And it really helps when you get specific information. If you say, hey, this happened with Summit County Sheriff on this date, and it was a male officer or a female officer, or if you don't have the name, but the more specific we can be, then the more we can learn. If we get a call that just says, oh, Salt Lake County Sheriff's Department stinks, we can't do a whole lot about that. But if we get specifics, we can certainly try to move and improve and get better, because we want to get better. We want to do the best we can by each community, best we can.
Right.
And I can just,
yeah, go ahead.
I can just kind of echo that, and also kind of to this whole conversation that kind of regardless of some of the efforts and training by law enforcement, there's also just a perception issue sometimes that makes it difficult for people to feel like they can advocate with police even under normal circumstances at times, depending on the situation. And the idea of using our community partners, whether in mental health or other nonprofits that work assisting people with different traumas, we have Connect, we have Clubhouse, we have Peace House, we have so many organizations within Summit County in general, that if there are issues that people don't feel like they can directly reach out to law enforcement for whatever reason, using some of these community partners can be a really effective way to be able to relay that information in a productive way that we can then, still, take into account and be able to utilize to improve our system. So thank you for mentioning that, both Amber and Dr. Sutter. I think that the collaboration really is key to improving our mental health system within Summit County generally.
I agree with that. And I agree that this conversation and conversations like this is what prompts us to know when we need to do better. And that's exactly what what we're moving this conversation towards now, is how as a community do we do better. And all three of you have spoken about ways to do that. This mental health, as one of our people listening pointed out, is not a mental health profession problem alone. It is up to us to identify and support and advocate. And, just because I, make my kids clean their room doesn't make me a bad parent, right? Just because somebody is intervening in your mental health crisis doesn't mean they're a bad person, right? It's all towards the same goal of moving someone toward being an independent member of this community or whatever community it is that they live in. I would like any of the four of you to talk a little bit about how we do better. Maybe Julia, is there a specific question addressing this? How do we do better as a community that you can offer up to some of the panelists here?
Well, we do have a question in the chat about, is the recommendation to call local police first? And then in parentheses, it says, I realize Park City Hospital does not have mental health services.
I can take that question. I think it would depend on the situation and the crisis. I think absolutely if somebody is making threats towards themselves or towards others, if there is violence, then I think police absolutely need to be called in those situations to ensure the safety of everyone involved. If it's a situation that appears to be escalating, that maybe hasn't risen to that level, there's opportunity to reach out to dispatch and have the mobile crisis outreach training team come, and that's always an option as well. If we're maybe leaning towards crisis but aren't quite there, that may at that point be an opportunity to reach out to Connect's peer support and maybe get some support prior to it becoming a full-blown crisis. And so I think it depends on where somebody is at. I think part of it is each person that's involved really kind of looking at the situation, but also asking questions. And that's something that can be called, call dispatch. Can I speak with an officer? This is what's happening, or discussing with dispatch. This is kind of what's happening. Is this the best route? I feel uncomfortable and requesting, maybe some advice for, is this appropriate for the MCOT versus a law enforcement? I think that that's something that could be helpful for individuals, because we do have options within this county as far as response. And we have a lot of other resources that can assist kind of leading up to a crisis. And also, as Amber stated, that component that comes after a crisis, and really supporting people as they deal with the trauma of the incident, the potential trauma of whatever the reaction to that incident was. I mean, it's really this full spectrum of service that I think the community really has been working towards. And we have several people on this call that have been very involved in that effort of kind of wraparound services for those experiencing mental illness. And we can absolutely improve, and we need to improve if we're going to be able to help all members of our community.
Right. And I just want to insert really quickly here that it is not that we don't have crisis intervention at our local hospitals. We have, you can get crisis intervention there. I think what is true is there is not a full-time crisis intervention team. But for our community, it is the first stop, and it is where it is necessary to go in a crisis to continue to move through the system to eventually get the help you need. They do deal with crisis, so I don't want to discourage anyone from making that the first stop in a crisis. And a statement when I spoke about our experience directly was that telehealth does work for some. And that is what we do have currently. And that does work. It did not work for us. So in that instance, I want to do better. And if other people have had that same type of experience, I would like to empower us all to speak about our experiences. Just like Dr. Souter said, negative or positive, we need to talk about that. It's the only thing that is going to affect change in our community. So I appreciate all of the reminders about that. Are there any other questions, Julia, that are appropriate to bring in right now in dealing with how can we do better addressing gaps? It sounds like Dr. Souter would like to say something here. Yes, please.
Please, yeah, thank you. I just wanted to jump in here to follow up on what Melina had responded to that question. I believe the question was something like, do we call police first? I would say that the most important thing is that a call does get made. Don't hesitate to call somewhere if you're in a crisis situation or a loved one is. The Utah State Crisis Line is 801-587-3000. I think somebody offered that up earlier in the chat. You can call 911. You can call your non-emergency number to law enforcement. The goal is to filter those calls to where they need to be. And MCOT, Mobile Crisis Outreach Team, are in communities that hopefully those calls will ultimately end up in our lab, where then we can look at it from a mental health perspective and move forward. The other thing I wanted to say just really briefly is of all the hospitals throughout the state of Utah, I don't know what the percentage is, but certainly not all hospitals have a behavioral health unit or an inpatient psychiatric unit. Not all of them do, and I don't believe the one in your community does. However, every emergency department is required to have mental health services and crisis evaluations as part of the services that they provide to the community. So if anyone were to go to a local emergency department, they would have a system set up to be able to provide a risk assessment. And even though that particular hospital may not have a behavioral unit, they can get a person where they need to go if that individual needs to be in a behavioral unit or hospital setting. So don't let those types of things be barriers to you getting help or reaching out to get treatment and care. Find that courage, pick up the phone, make a call, and eventually people will triage or get you to where you need to go in order to get your needs met. And that's one of the things that Natalie referred to earlier in the call, is that 988, that 3-digit number, 988, which is supposed to be coming forward within the next year, is just another avenue to get your needs met. So if people are in a legal or criminal or physical health crisis, they would still call 911. But if it's more of a mental health crisis without those other elements, 988 will become a national number, and we'll continue to try to promote that. And I'm sure, just to be understanding and patient, there's going to be problems and hiccups and difficulties as we begin this process. If you have those, let us know so we can continue to move forward and again, grow and improve it. So thank you.
Thank you. And our goal at Connect Summit County, obviously, is to destigmatize mental health. This conversation is helping move us in that direction. I hope even after this conversation, more people have a different outlook or different comfort level with getting intervention. So I am really grateful for the positiveness of this conversation. And I am hoping that people are hearing, make the call, get someone somewhere, somehow to help you help your loved one. We are talking a little bit about how do we do better. One of the ways I believe that we can do better is, as I've stated many times, have the conversations. There are ways to avoid crisis with your family members, your loved ones, friends, nieces, nephews, grandkids, whatever. There are ways to avoid potential crises. They happen despite some of the ways we try to avoid them. But I would like now to talk a little bit about some of the ways that we have in our community avoiding these crises. Jackie, can you talk again a little bit about maybe a type of phone call that you would get on the peer navigation line and how you would work with that person to find some help?
Yeah, so we get about half our calls are from friends, family, acquaintances, employers, other people concerned about someone in the community, and then the other half are the person themselves. So we do as much as we gather as much information as we can, and then we go through at the bare minimum. This is, something they can do, whether it's an app or a book or a support group or educational opportunity in the community. And then if they're specifically looking for providers, therapists, we'll look through who's available. We try to keep up to date on who's still accepting new patients, how long wait lists are, and if we can get them in as soon as possible for those kind of things. And then we look at funding. We look, do they need scholarships? Do they need a sliding fee? Are they gonna be able to do it through their insurance? So we try to steer them that way to where they need to go. We give, and then at the very end, everyone gets the crisis information. It's like, if this escalates, if this gets, out of control, here's what the next thing you do is you call. So we give them the steps, and they are, usually we give them at least 10 referrals, or and with the invitation, please come back, call us if you can't get in. We try to stay in contact with them to make sure that they are being seen, that their needs have been met. So I would love to see more of a proactive way of handling mental health, like we do our physical health, where we have a living will and we write down our wishes and we write down who our advocates are, who would speak for us when we can't. And I'd love to see that done for mental health. I would love, before you're in a crisis, you have this information that here's who to call that will advocate for me. Here is a diagnosis I've been given, my meds. Don't ever give me this med because this would be bad. If that information was done before the crisis, and you've established who will help you and where you want to go, and it might not roll that way because sometimes beds are full and things happen, but at least you have something that's guiding the police that show up, or because as a psych nurse, I know the more information we can gather, and which is impossible to do with someone's in psychosis, right? If we can have that information beforehand, we can make it a much better experience for everyone. So that would be my advice. Get a safety plan or some kind of living will for mental health.
Right. I appreciate that. And I know some of the advice given to me was to get in touch prior to a crisis with our local law enforcement and let them know that I have a loved one that has a mental health issue. And if something happens, please put that in whatever file you have, and know if you get a call from any entity about this human, there is a mental health challenge. And I see some chats going on about a hospital, and hear some of your comments, Jackie. What was also empowering for me as a family member is knowing ahead of time. Like, I didn't know until we went to the hospital that there was not a full-time crisis intervention team. Know that ahead of time. If you have someone in your life that is struggling with a mental health issue, know these things. That way you can be the very best advocate for that person, for yourself. That stop did help us move through the system, even though our immediate needs were not met to get to a long-term place of better health. So know these things ahead of time, and have these conversations with Jackie. If you're listening out there and you have questions, call that peer navigation line. Amber, I'd like for you to talk a little bit about, you talked about the clubhouse. Tell us who a typical client of the clubhouse is, and you have things at the clubhouse such as job coaching and things like that. All of these are empowering for someone with mental health issues that help them avoid a crisis. Please tell us a little bit more about that.
Yeah, thank you. Well, I think that one of the reasons why the clubhouse was invited to come to Summit County in 2019 was because there needed to be something that was structured, that was helping individuals stabilize in the community, like post-hospitalization. Kind of look at the clubhouse as like an in-between hospital and home. So you don't live at the clubhouse, but the clubhouse is a great support system for all of those things that almost kind of keep us away from crisis. So when I look at someone, or when I see someone that's in crisis, a lot of things are common denominator, especially with the members of the clubhouse. Struggling with my job, I'm homeless. We're seeing homeless right now, and that's really difficult. It's going to be a conversation for another day too, because it's a big, issue. But when you don't have a place to live, crisis comes a lot quicker. Isolation is huge, and I think we've all felt isolation, especially in the last 2 years of COVID. If you didn't have a mental health issue before, there's probably some anxiety we've all experienced because of COVID, and having to stay home and having to quarantine if you're sick, or having to lock down. Isolation is really, really hard on someone. And we typically see that when someone's about going into crisis, or they're on their way to the hospital, the typical thing that we're seeing is they've been isolating and they don't have a community of support. So one of the things I always recommend is get a community of support around you, whether it's your church, whether it's your neighbors, your family, your friends, a clubhouse, a support group, because those are going to be the people that keep you from the isolation. That's that kind of next step to hospital. But when people come out of the hospital, Dr. Sauter was talking about, it takes a lot of courage to call, to make a crisis call, but also takes a lot of courage to come back out of the hospital and go, what do I do next? How do I get back to stabilizing my life? A lot of times the discharge plans are sometimes not always the easiest to follow, or they're not really comprehensive. I had a member tell me the other day, they got out of the hospital and they sent him in a cab and sent him on home. Like there wasn't really like a great discharge plan for how am I going to be supported once I leave the hospital so that I don't find myself back in the hospital, right? So the clubhouse can really support that. When someone gets out of the hospital, they can come to the clubhouse and we can say, let's sit down and call your therapist or your med management person together. Let's sit down and call your job and help them to understand, I've been ill, I've been in the hospital, I couldn't come to work, but I need an advocate to help me maintain my employment. Let's sit down and figure out how, where you're going to put a roof over your head tonight, because if you don't have housing, stability is just really not there. And so that's a lot of what the clubhouse can do, is really support individuals to get stable so that they're not doing that revolving door trip. But the best things we can do to do better is ensure that we have the services available for employment, education, wellness, housing, so that people are living that independent life. Clubhouse is actually a evidence-based model, and the evidence that it's based on is the fact that when you become a member of a clubhouse, you can reduce your hospitalizations up to 85%. And why that happens is because there's a community of people that are following you and supporting you and reaching out to you, and can kind of almost be that intermediate, like if we see you're about ready to head to the hospital because you're isolating, let's get you to your therapist first so that we can kind of avoid that. Clubhouse follows our members to ensure that they're healthy, and that's why the hospitalizations go down. I've had so many members come to me and say, man, if I just learned about the clubhouse 5 years earlier, I would have saved myself 18 hospitalizations. I mean, that's a real thing, because they now have a community of support. And so I think that's the biggest thing. If we can do better, it's to make sure we're helping people with a community of support.
And I know that you're talking about housing and how that can lead to, or lack thereof, lead to a crisis. I think that meals and food and a warm meal, and that's something else you also do there. So I am so grateful for the presence of the clubhouse and what is happening there. And I think we all can be a referral source to you and everything you and the team over there at the clubhouse does. I know that I'd like to move into, how do we make our voices heard? But we talked just very briefly about the 988 line. Is Dr. Sauter available there to tell us when the rollout of that is and what population that number is going to be able to hopefully help and intervene with?
Unfortunately, I have no answers to those very good questions. I had heard most recently that April 2022 was going to be the date that began rolling out this project. I'm not sure that that's still on target. There's a lot of logistical things to consider and work out, including navigating cell towers and all kinds of things like that. So I don't know what the latest was, but I'm assuming it's not going to be April 2022. But that's all the information I have. Sorry.
Okay, and that is okay. But I appreciate that number is coming. I want to move, we're nearing the end of our conversation, and I know for all of us, this is a very passionate issue. In one of the conversations yesterday, we talked a little bit about how to be an advocate. And someone in one of those conversations mentioned reaching out to your legislators. and just making yourself known, making your desires on how we can improve in this community known. We have a council person here with us. And I know that it is one of the top 5 initiatives of Summit County mental health is. And I appreciate that. That is not the case in every community. Melena, do you have some suggestions on how we can make our voices heard, where to go, who to talk to, what bills to pay attention to, so we can be that loud noise in everyone's ear as we continue to advocate for those that are struggling with mental health issues?
Absolutely. I think right now, so through the legislative process, appropriations process, there's been money allocated for establishing in some rural communities what's called a receiving center. And I think Dr. Souter had mentioned that previously. And this would fill a gap within our community as far as those that have engaged with law enforcement, perhaps reached that threshold of being, having committed a crime that's not violent, but would allow them to enter into a timeout, essentially having a place established so that people could go have a timeout and then have some mandatory service plan requirements that would allow them to not have any sort of charge, because that's an issue that we've seen that we haven't discussed as much here, is that intersectionality with mental health, crisis, mental illness, and our criminal justice system, as far as charges that are sometimes relayed with people that have committed crimes that are a result of that mental health crisis. And so a receiving center would also allow for those people that are experiencing crisis that haven't necessarily had interaction with law enforcement to call and just have a quiet place to feel some support while they're going through that crisis and have access to resources. That's something that we right now are looking at completing an application for to be able to access those resources, whether in Summit County or broader along the Wasatch Back. And so with that, we would love to hear comments, testimonials for how that would be helpful for individuals as we prepare that application to hopefully procure some of those appropriations set by the state during this session.
And Dr. Souter, at the state level, do you have any advice for us who want to make a difference in the realm of mental health?
Yeah, I would say be vocal with your legislative people. And I think the best way to do that is really through a positive approach and to try to assert yourself in terms of what you would like to have happen. So you come with a positive approach and maybe some type of a solution, be solution oriented with your suggestions and recommendations. But I certainly would support just people reaching out to their local legislative groups and working through them to try to influence what bills are out there and what's happening in terms of moving forward.
I appreciate that. And I know continuing the discussion within your circles, within the community and the county, have these discussions with your physician, have these discussions with your therapist, have these discussions. I know for a long time, because of shame and stigma, I personally was a little afraid to talk about these issues. And I know, again, yesterday we had a conversation that talked a little bit about planting the seed, is having conversations, planting a seed, giving someone putting somebody in a box of a diagnosis or what have you. But it's been my experience, and I know it's the experience of others, that is not the case. Mental health is something that affects each and every one of us daily and can really rock your world if it gets to the crisis point. I would love to ask for any final thoughts from our esteemed panel here, or perhaps address one or two questions, Julia, in the last couple minutes here, if you have a few questions that are common throughout the chat.
Natalie, if I could just, as we're looking at questions,
Yes.
one more comment.
Please.
Piggybacking off of that, I mean, in addition to contacting legislators regarding some of these issues and how we can deal with that statewide, speaking for both my council and I would say for the city councils as well, that identifying the gaps within our mental health system is really critical. I think we all do the best that we can to identify those, but from the history over the last 6 or 7 years, the gaps within the system have been best seen and communicated through those people that have been using the system, through our residents, through our community members that have then communicated that with elected officials and with nonprofits within this space. And so I think that those conversations are critical simply to enhancing our mental health system. And although that can be maybe challenging, but please reach out if you've experienced some negative situations or positives, or just, think that the system could work better in a specific way. Please help us to identify those gaps. If it's more comfortable to speak with Amber or with Connect in a peer support role, or if you feel comfortable reaching out to me or one of the council members, we would like to understand more fully how we can enhance our system so that we're best serving all of the residents of Summit County.
Natalie, there is a question for Amber about how many members can be in the clubhouse. Do you have a capacity that where you would cut people off from coming in? You're just so full, but yeah, what can the clubhouse handle?
Our only capacity, limit is our space, which, by the way, we have a new space and it's done. And we're so excited to invite any and all of you over to see our brand new space that's accommodating our members and their work. It's just the physical space. I believe we can hold up to 25 at any given time. But we're also really excited to share that we can work with English and Spanish speaking individuals too. We have a Spanish speaking team. So please come and take a tour, and we have plenty of room to support any individual who is looking to get support with our services, and we're excited to share our space with you all.
Thank you, Amber.
And Amber, to clarify, that's just 25 people present at any given time, but it's kind of people come and go. And so you could have 100 members of Clubhouse that just came at different times and interacted at different times.
Exactly. Our space capacity is just 25 at a given time. Yep.
And thank you for that. And I will remind everybody, if you don't know where to start, calling Connect Summit County is a great place because our peer navigation team can help you realize where the starting place is for you. And there are also Spanish speaking services through peer navigation with Connect Summit County. I am going to just give my extreme gratitude and thanks to this esteemed panel for all of you who took time out of your day today to listen and be part of this discussion. I know you didn't have to do that. And I just appreciate the panelist time. I appreciate all of you listening. And as we mentioned, there are places to go toward improvement, but there are many things that are available to you right here, right now, to help you in your mental health challenges. And on that note, again, my thanks, and I'd like to just pass it over to Julia for some final thoughts.
Thank you, Natalie. And thank you so much to the panel. So in conclusion, we want to just make sure if you or someone is struggling with mental health and you need resources, as Natalie said, please contact Connect Summit County's peer navigation line, we connect people in our community in need of mental health resources with those who offer mental health services. And again, Natalie, I want to thank you so much for moderating today, and all of our panelists. Thank you so much for your insight and your expertise. This has been a fantastic panel today. I know I have learned so much. So, and to our participants, thank you so much for attending today's event.